Today we are going to discuss about breast cancer. There are very many important reasons for people to be aware of breast cancer and its importance in our lives. First, breast cancer is the commonest cancer found in women, accounting for more than 25% of all cancers in women, which means almost 1 in 4 of all cancers in women will be breast cancer. Second, the incidence of breast cancer is increasing and is in fact predicted to increase more in the next 2 decades. So it is important that every person in the community, particularly women, be aware and empower themselves so that they can reduce their chances of getting the breast cancer as well as seek medical attention at the right time. Breast cancer is commonly seen beyond the age of 45 to 50, but it can happen at younger age in women with family history of breast cancer. Particularly, there is about 10% of breast cancer which can be passed on from mother to daughter, which can happen at a very younger age, like in the 20s or 30s. So what are the risk factors for getting breast cancer? We knew for a long time that long exposure to the hormone called estrogen, which is predominant among women, is a key player in causing breast cancer. So when does long exposure happen? If a girl gets menarche, that is, she comes of age very early, or if a woman attains menopause at a very late age, automatically the duration of exposure to estrogen becomes long. In recent times, there are other environmental and lifestyle factors which are also well recognized as risk factors. Obesity or excess weight is one of the most well known and is accounted for the increase in urban women, who generally tend to have a higher average weight than rural women. Coupled with the excess weight is lack of exercise and eating of wrong food, in particular high fat and fried foods as well as processed foods. Second, as I said, the risk is increase in women with family history, so they need to have extra awareness about family history and their own personal risk. With regard to early detection of breast cancer, every woman from the age of 20 should practice something called breast self-examination, which is freely available online. It takes approximately 15 minutes of time and privacy. It needs to be done only once a month, preferably 1 or 2 days after the menstrual cycle. And the idea is that the woman will get used to the normal breast, the texture and what it feels like, so that when any abnormality is detected, they can immediately seek medical advice to determine whether this is serious or otherwise. In addition, it is also recommended that women under 40 should probably see a doctor once a year for examination by the doctor to corroborate their own findings. Women who are above 45, there is also a special X-ray called mammogram, which is recommended for early detection. So these are ways of detecting early breast cancer. Why is that important? Because early breast cancer is very much curable. The cure rate for early breast cancer goes as high as 95%. So early detection and awareness is extremely important and cannot be overemphasized. With regard to treatment, the treatment of breast cancer is evolving. Traditionally, we had 3 methods of treatment: surgery, radiation, both of which are usually applied if the breast cancer is confined to the breast, and chemotherapy, which works both for local disease as well as disease which has spread beyond the breast to other parts of the body, what we call medically metastasis. But in recent years, we have several other ways of treating medically. One is called targeted therapy, where we can actually identify genes which have mutated or altered irreversibly and are causing the breast cancer to grow, and then have specific drugs which will neutralize the effect of those genes. So by doing a gene panel examination on the individual woman affected by breast cancer, we can identify such a specific gene and a specific targeted therapy, and this is called personalized medicine because this is predicted to work for her. Very often these drugs are much safer in terms of side effects and are also safe to give for a prolonged time. There is yet another innovation called immunotherapy. So in people who get cancer, the immune system or the specific cells which are responsible for blocking the cancer have been affected. So what the immunotherapy does is to activate and strengthen those specific immune cells of the patient to destroy and eradicate the cancer. In recent times, even chemotherapy has been modified as a sort of targeted therapy by combining it with a targeted therapy, and these are called antibody drug conjugates, and already a few such drugs are licensed in the use of breast cancer. So the message from the treatment point of view is that there is a variety of treatments available to treat breast cancer, not only in the early stage but even in advanced stage. With regard to the screening, I told you, one other factor I want to mention is that women with hereditary breast cancer, meaning that their mothers have a gene which is driving a breast cancer, they have a 1 in 2 chance of inheriting such a gene, and there is a test available to test for such mutations, and if it is present, they should consider screening with mammogram earlier. They should consider more closer surveillance, and in some countries they even opt for preventive removal of breast, which is also an option available to women, which is her right to exercise. So the scenario for breast cancer has improved remarkably over the last 15 to 20 years and is all set to get even better. So there is no need at all to fear breast cancer. Awareness and early detection will ensure a total cure. I hope all of you remain health aware and take care of yourselves. Thank you.